Hello, dear members. I hope you all will be good. Today we will be discussing about the contraception, family planning. Actually, I was making a video about menstrual abnormalities, uh, but the questions you are asking about the contraception are much more. So I decided to switch this, and I'll make another video any other time. So contraception is actually the contraceptive method are a wide variety of methods that we use for contraception. For example, some ladies like to take the pills. Some got the flavor of contraceptive implants. The other would like to do contraception via the intrauterine device. Some use the condoms. Some use the diaphragm with spermicide. What do I mean by this is that it's a wide range of methods. It has so much more varieties, flavors. You have your own choice. Your doctor, like I would, if a patient come to me, I will explain each and every side effect, either it has the pros and cons, all I will explain to her, and then I will let her decide. Don't pressurize your patient to get this kind of contraception. I will put the side effects, the advantages as well as the disadvantages of a contraceptive method, and then I will let her decide, or I will let the couple decide what kind of contraception they are up to. I guess videos will be in parts, because the contraception that I recommend to my patients are so much more, and I don't think that it will cover up in one video. First of all, you have asked about the IUCD, which we call the intrauterine device. Before letting go to that, let me tell you about another thing, that there is a new concept since 2017, that is called the emergency contraceptive pills. They are pills that help prevent pregnancy when taken within 5 days after unprotected intercourse, or a mistake with a family planning method. It's just like a remedy, a quick remedy to get your contraception track back. You have to take the medicine. Remember that you can take it only within 5 days after unprotected intercourse. It is safe for all women. The good advantage is this, and it is good as well that they do not disrupt the pregnancy or they harm the baby if a woman is already pregnant. It has no disadvantage over the baby. This is a remedy, a quick remedy, but remember that regular family planning methods are more effective, and please consider starting another method after taking the remedy. What is an intrauterine device? It is a small flexible device with either copper or hormone placed inside the womb. It's very effective, I guess, and it is reversible. It is long term. We use a wide variety. The copper mainly is made of copper. We call it 380A IUD. Can be used at least 12 years. It's very effective. Hormonal, which is hormonal, also IUD is used, and we call it, the brand name sometimes in some countries is in the Pakistan, it's used as LNG IUD. We can use it for 3 to 5 years, although the IUD can be used for 12 years. It can be inserted right after childbirth as well as other times. A lot of patients ask from me what is the exact time for the IUD insertion. It's right after childbirth. As I told you earlier, don't confuse yourself. You can also insert it any other time, appropriate time. Some pain during insertion. With a copper IUD, monthly bleeding may be heavier and longer as well, especially if after first menses or after the insertion of IUD. When you use a hormonal IUD, it is good that there is no heavier bleeding and help prevent anemia because the blood is not that much loss. The blood loss is not that much. The serious complications are rare, and the pelvic infection occasionally occur if a woman has a certain STDs, which we call a sexually transmitted disease. If she has, it may cause infection while interacting with that infected area. Otherwise, complications are rare. It can come out on its own, especially at first. The woman is unaware and it might have gone. And when she got pregnant, she know at that time that, oh my god, my IUD is gone. So you have to be careful about that as well. A woman can become pregnant with no delay after IUD is removed. If she want to conceive, then definitely she can remove it, and she will conceive right after the removal. So this was only one device, and emergency contraception and IUD. These two are covered in here, and I'm thinking about the other videos that the other contraception parts will also be included in part 1, part 2, part 3. But it's almost 7 minutes, and I guess you will be bored too. I'll make it in the another video. The other contraception. This will be part 1, but please make sure to subscribe. That's all for today. Allah Hafiz.